Hello everybody and welcome to the Thursday edition of Video Clips. And I want to start by talking about statin drugs, which are prescribed to tens of millions of people annually. And people really don't know the true story about statins, that first of all, they're not very effective. Crestor, for example, reduces the risk of a major event by 1.2%. The drugs cause serious side effects, and better options like a plant-based diet are available. And the sad thing is that most of the doctors prescribing these drugs don't know what I just told you either. Statins are presented to most people as the best way to prevent heart attacks and other events, and side effects are rarely discussed. However, patients find out real quickly about the side effects, and one result, and a new study shows this, is that a lot of people stop taking them. So this study involved adults who got a prescription for statin drugs between January of 2000 and December of 2008. And what they did was follow these people and ask them why they stopped taking their drugs. And about half, over 50% of the people stopped taking the drugs, at least temporarily, many of whom had an adverse event. And about half of the people who had an adverse event were talked into retaking drugs or taking a different statin drug by their doctors. The researchers concluded that adverse events from statins were common and that this often led to discontinuation of the drugs. They also stated that patients can be talked into trying them again, and that most of those who are convinced to do this then stick with the drugs. They suggest that perhaps the side effects might have even been due to other causes, and that taking a different statin drug might not have the same side effects. The message is real clear based on this article, though, and that is that doctors should really tell their patients to take the drugs, push the drugs on people. And the message this kind of thing sends to the patients is real clear. Do as you're told and take your drugs. And an editorial published in the same issue, Dr. Stephen Grundy states, in the same issue of the medical journal, states that in addition to side effects, the decision to not take statin drugs was based on patients just not wanting to take the drugs for the rest of their lives. And most of the medical community, if you read some of the blogs and that sort of thing, they attribute this type of behavior to people who are just like sort of lazy and they don't care about their health, they're not willing to do what they're supposed to do and be compliant. I interpret it, however, entirely differently. What this tells me is that patients are dissatisfied with taking drugs, which means that they might just be open to a discussion about a different alternative. Our experience has certainly shown this, that when we have what I call the informed consent discussion with patients, here is what we can do with drugs, and here's the downside of taking them, here's what can be done with diet, don't have all those side effects. A lot of people are motivated to do it, and when diet works, which it usually does, people are pretty motivated to be compliant. We have far fewer issues with compliance than a lot of our critics in the health professions might think we do. It's truly a shame, in my opinion, that most doctors just have drugs and coercion in their toolbox for helping patients. The patients are obviously ready. I mean, if over 50% of the people prescribed a statin stop taking it, most of whom are concerned about side effects, what a great opportunity. We need to reach those patients, and then we need to just drag the doctors kicking and screaming into the 21st century and introduce them to a model of healthcare that's focused on spectacular living without better chemistry. So anyway, I always see the silver lining in the cloud. Everybody thinks it's awful. I think, well, the fact that people aren't compliant with drugs says we've got a big opening to get to the people. And so while we're on the subject of drugs, for many years I've been writing about attention deficit hyperactivity disorder. I caution people that in most instances it's a made-up condition. The drugs, the diagnosis is so subjective as to be meaningless. And the drugs don't help children or adults in the long term. In fact, they increase the risk that more mental emotional issues will develop, and then there will be more medication required. A new paper shows that the chance of being diagnosed with ADHD varies by geography, which goes to the point that the diagnosis is subjective. It really, in this case, depends on where you live, and I'll tell you what the relationship is in a second here. People are more likely to be told that they have ADHD if they live in one part of the country versus another. The authors included data from 2008 that included both children and adults. 300,000 providers issued prescriptions to 6 million patients. The data set was really, really large. And the statistics were amazing. First of all, about 2.5% of kids under the age of 17 were found to be taking stimulant drugs. And the prevalence depended on geography. So, for example, Alaska had the lowest prescription rate. Delaware had the highest. And there was even variability in counties inside of the state. So what accounted for the variation? Well, here you go. The more the number, the higher the number of practicing pediatricians in the area, and the more money spent on special education, the higher the prescription rate. The authors wrote, quote, "Where one lives matters greatly for the likelihood of being treated with stimulants." Of course, some argue that more doctors and more investment in special education is a benefit, but I disagree. Articles are appearing weekly in medical journals now acknowledging that significant numbers of people are being over-tested, over-diagnosed, and over-treated by medical doctors and health organizations. A great deal of this activity takes place with diseases for which the diagnosis is far less subjective than it is for ADHD. For example, I recently wrote about an article in which academics are questioning the wisdom of medicating older people with high normal hypertension. There's no disagreement about the diagnosis. The patients actually have hypertension. The issue is that more people are being harmed than helped by the medication. The subjective nature of diagnosing ADHD makes the potential for overdiagnosis and overtreatment even more likely. Observations of teachers and parents are highly variable, and the questionnaires are so broad. I've taken these little questionnaires, and on some days I qualify for a diagnosis and medication. And of course, some of my detractors out there are probably saying, I hope somebody medicates her soon so we don't have to listen to this anymore. But the bottom line is, I don't think I have a problem. But if you take some of these tests, you'll be surprised at how broad and sweeping they are. So it's really time, bottom line here, to start addressing the inability to focus and pay attention for what it really is. It's the lack of a skill that can be learned with the right assistance, incentives, and training. And we got to stop drugging the population. We got to drug for everything. And we're drugging people who don't need to be drugged. And we're hurting more people than we're helping. So not likely to get this type of information from your doctor, so we got to deliver it directly to the folks so that they can make different decisions when confronted with prescriptions by their doctors. Learn to just say no, and particularly when it comes to this diagnosis. All right, that's all for today and all for this week. Have a wonderful day and weekend, and I'll be back to you again next Tuesday.